Hi, this is Andrew Herrera from Curamericas Global. I want to say thank you to the United Way of the Greater Triangle for their support from the Rapid Response Fund. Their $5,000 grant has been monumental in helping us to reach our neighbors. Curamericas Global is a small nonprofit here in Raleigh. We've been saving moms and babies around the world since 1983. We use experts trained in public health and community health to reach the hardest to reach communities. As of about 3 years ago, we started working here in North Carolina. We knew that there were forgotten communities to work with right here in our own neighborhood. I'm proud to say that in partnership with the Guatemalan Consulate, we've begun serving our friends in North Carolina. We had to quickly pivot with the COVID-19 emergency. It's been wild. It's unprecedented for all of us. And we know that it's affecting our daily life and affecting the way we see the world permanently. But we also know that it's affecting some more than others. That's what Curamericas is responding to. We're seeking out the hardest to reach, the most vulnerable communities, to provide them evidence-based information on COVID-19, on how to prevent it, on how to keep your family safe, and on what to do in case you think you're sick. We want to make sure people have knowledge and information because that's the first step to being healthy. We're using volunteers from around the country to call our neighbors here in the Triangle. We have 188 volunteers making phone calls in Spanish. These volunteers come from the UNC School of Medicine, where 35 third-year students are helping us make calls in Spanish. These volunteers come from the Duke School of Nursing, where 32 nursing students plus their instructors are helping us with our campaign. They come from NC State and ECU, from UVA, from retired communities, from high schools, from around the country. We're going to do more, but we couldn't do it without these incredible volunteers. They're trained, they are signing policies, they're working remotely to call the most vulnerable and to provide evidence-based information. We've heard some heartbreaking stories. A mother who was scared because her kids had asthma. She was worried, what is COVID-19 going to do to my children? After talking to one of our volunteers for over 15 minutes, she felt a lot better because she had evidence-based information. She had knowledge. She knew how to keep her family healthy. She knew what to do in case she was exposed to the virus. We had a father who was worried about putting food on the table. He lost his job because of this economic crisis. He was concerned about the most basic of needs, food for his family. Our volunteers connected him to a resource in his community where he could go to get food. We had a mother who had trouble breathing. She was under distress for hours. She didn't know what to do. We had a nurse follow up with her and get her to the hospital, but not just to the emergency room. They followed the guidelines by UNC Health to make sure she was tested, she was screened and tested. That helped them reduce the burden of the hospital system. That helped that mother in need. There are many, many more stories like this. We couldn't do it without the help of the United Way of Greater Triangle. Thank you very much for your support in this Rapid Response Fund. Please consider joining us and being part of the solution to make our world better, to respond to this emergency. We're in an emergency and we all need your help. Thank you.